Technical Veterinary Learning TVL channel. Founded and produced by Prof.Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, ex-head of Department of Veterinary Medicine, ex-Vice Dean of Faculty of Veterinary Medicine, Beni-Suef University. Exotic diseases by means of transboundry diseases. Transboundary diseases that all diseases transmitted from other countries and not reported before in the country that showed it recently, such as contagious bovine pleuropneumonia that recorded in the 50th of the last century for the first time in Egypt. The most famous examples are SARS-CoV-19, which reported as a pandemic in the whole world at the beginning of 2020. Foot and mouth disease type C virus if it enters to and free zone or countries. Bovine spongiform encephalopathy that reported in England at the last of 1997. Scraby also reported in England at the same time. Rift Valley fever that reported in Egypt at the 70s of last century at the areas of Suez Canal. Bovine viral diarrhea, which reported in the Middle East and Egypt at the beginning of 70s of 1970. And contagious bovine pleuropneumonia, which reported in our country at the late of 50th at the last century. Contagious bovine pleuropneumonia, CBPP, that take another name as lung plague. Contagious bovine pleuropneumonia, it is a highly contagious septicemic disease of cattle and closely related ruminants. Pan-African Program for Control of Epizootics, PACE, which is a program implanted in 32 African countries, identified contagious bovine pleuropneumonia as the second most common transboundary disease in Africa after rinderpest disease. Contagious bovine pleuropneumonia presents a constant risk for disease-free countries with relaxation of import controls and increase in the international trade exchanging. Contagious bovine pleuropneumonia is characterized by localization of lesions in lungs and pleura. Clinically affected ruminants with contagious bovine pleuropneumonia characterized by fever, agalactia, coughing, thoracic pain, dyspnea, expiratory grunting, pleuritic frictional raps during stethoscope examination of the lung area of infected animal, edema of throat and dewlap, dull areas present in the lung area when examined the affected animal by stethoscope, arthritis in knees and joints. Epidemiology of contagious bovine pleuropneumonia. First, speaking in the epidemiology of contagious bovine pleuropneumonia, we will speak about the pathogenic risk factor that reported by OIE at 2020. Mycoplasma is a well-less bacterium, mollicutes, belonging to family Mycoplasmataceae, that belonging to Mycoides cluster, including Mycoplasma capri, column subspecies Capri pneumoniae, Mycoplasma leishi, Mycoplasma mycoides subspecies Capri. Pathogenic risk factor of contagious bovine pleuropneumonia, known as Mycoplasma mycoides subspecies mycoides, small colony form. They are pleomorphic and some of them are filterable. These organisms are very fastidious in growth in their culture. PCR is a highly specific, can identify the organisms within 2 days. They are quickly inactivated in surrounding environments. These organisms does not survive in meat or meat products. A figure shown the shape of Mycoplasma mycoides subspecies mycoides small colony as a pathogenic risk factor for contagious bovine pleuropneumonia. This figure shows many of Mycoplasma mycoides subspecies mycoides of a small colony. Closer view of Mycoplasma mycoides subspecies mycoides. 3D image of Mycoplasma mycoides subspecies mycoides. Occurrence and prevalence of infection of contagious bovine pleuropneumonia through the world will be discussed through the following slides. Contagious bovine pleuropneumonia cause very heavy losses in many parts of the world, especially in Africa, Middle East, Southern Europe, and parts of India and China. The most recent notifications about occurrence of contagious bovine pleuropneumonia caused by Mycoplasma mycoides subspecies mycoides, a small colony, announced at 13th of October at 2022 in Namibia. Contagious bovine pleuropneumonia outbreaks from the most recent events in Namibia on 13th of October 2022 at the south part of Africa. A picture of a map last updated May 2022 of World Health Organization members that officially interested in contagious bovine pleuropneumonia status. The green areas here denoted to members and zone recording as free from contagious bovine pleuropneumonia. The countries that take grayscale here denoted to countries and zones without an official status for contagious bovine pleuropneumonia. Countries with contagious bovine pleuropneumonia are 30 countries in the sub-Saharan of Africa. They are already desperate economic situation. This disease causing highly economic and social impact in these countries. Countries with contagious bovine pleuropneumonia in Africa. In East of Africa, contagious bovine pleuropneumonia is endemic in Burundi, Rwanda, large parts of Tanzania, Southern Sudan, Ethiopia, and Somalia, while in West of Africa are endemics reported in Guinea, Mali, Niger, and Mauritania. South African region, as Angola and Zambia, are also infected with contagious bovine pleuropneumonia. Countries of contagious bovine pleuropneumonia in Asia and Europe. Contagious bovine pleuropneumonia has been reported in Asia at some area in India, Bangladesh, and Myanmar, while China declared itself free from this disease in 1996 and is currently officially reported free from the disease by OIE organization, while at 2004 Europe is free from contagious bovine pleuropneumonia, and the European Union rules now prevent the importation of live animals from affected areas. Conditions for rapid spreading of this disease. Vaccination program reduced its situation. Draft conditions, including increased movement of animals, increased the spreading, and this mainly reported in Africa. Threaten social well-being and survival of peoples, usually linked with movement of their flocks of cattle. Morbidity of contagious bovine pleuropneumonia increases with close confinement, can reach to 100% in susceptible herds. 25 of recovered animals may become contagious bovine pleuropneumonia carriers. Mortality rate of contagious bovine pleuropneumonia ranged from 10 to 70%. It's affected by secondary factors such as nutrition and parasitism of affected animals. Sources of infection for contagious bovine pleuropneumonia. The focus of infection is often provided by recovered or carrier animals. Pulmonary sequestrum preserves a potential source of organisms for periods can reach to 3 years. Conditions for stress attributable can cause the sequestrum to break down and convert the animal into an active case. The most common cause of outbreaks with contagious bovine pleuropneumonia, including introduction of carrier animals to susceptible herds. Number 2, inhalation of infected drops of coughing animal and close contact are necessary. This picture explains the normal shape of grazing of cattle herds where close contact between the animals can cause spreading of the microbial agent in fast time. Number 3, organisms present in all secretion and excretions of affected animals, such as saliva, urine, fetal membranes, and uterine discharge. Infected hay remained infective for up to 144 hours. A spread of pathogen may also occur by discharges from local tail lesions resulting from vaccination with virulent culture. Cattle may be infected for periods up to 8 months before the disease becomes apparent. Managemental risk factor for contagious bovine pleuropneumonia. Occurrence and incidence of contagious bovine pleuropneumonia is heavily influenced by management system and disease control policies regulation of any country. Number 1, effectiveness of education programs and the desire of cattle owners and the traders to control the disease. Number 2, knowledge about the disease by farmers and veterinarians and livestock field officers. Number 3, the diagnostic capacity of veterinary laboratories for diagnosis in a rapid process. Number 4, presence of disease surveillance and monitoring system. Number 5, adequacy of vaccination programs present. Number 6, governmental budgets allocated to control the program. Animal risk factor for this disease. Animal risk factor of contagious bovine pleuropneumonia, including cattle, Pos taurus, cattle, Pos indicus, water buffalo, Bufalus, yaks, Pos grandix. The English name and the other name is by Latin. Wild and small ruminants can contract contagious bovine pleuropneumonia but are not currently considered to play a relevant role in the epidemiology of it. Thanks God that contagious bovine pleuropneumonia is not a zoonotic disease, as humans are not susceptible. Economic importance of contagious bovine pleuropneumonia. Contagious bovine pleuropneumonia, as we referred before, it is considered the second economically most important disease of cattle in Africa. Number 2, direct losses that occur by deaths, reduction of milk yield, vaccination costs, and the disease surveillance. Indirect causes of this disease including chronic nature of the disease, decrease of weight gain, loss of body weight, impaired working ability, reduction in the fertility, losses resulting from quarantine, and number 7, losses related to restrictions of cattle trade movement between countries. Pathogenesis of contagious bovine pleuropneumonia. Pathogenesis of contagious bovine pleuropneumonia. Mycoplasma mycoides subspecies mycoides, small colony, as a pathogenic risk factor, invade the lung cattle through inhibition of ciliary movement in the trachea and lysis of erythrocytes during their production of hydrogen peroxidase and other active oxygen substances. This leads to thrombosis in the pulmonary vessels, probably before development of pneumonic lesions. This will cause anoxia that maybe lead to death or toxemia. Also, mycoplasmia, by means that reaches of the organisms to the blood, will lead to localization of them in the kidneys, joints, and brain for forming different forms of this disease. Field diagnosis of contagious bovine pleuropneumonia. Number 1, clinical signs. Subclinical or subacute infections. Infected cattle in this step can be carriers from few days up to 8 months. Shape of cattle, taken woody cow at carrier stage in subclinical stage. Number 2, acute infectious. The incubation period ranged between 10 days up to 6 months. The first signs are lethargy and anorexia, then fever and cough, and then it changes in posture. Adverse signs are thoracic pain, reluctant to move, then elbow abduction with mowing during expiration. Number 3, increased respiratory rate up to 55 breaths per minute. This figure showed a cattle infected with contagious bovine pleuropneumonia, where these cattle showed neck stretched, coughing, legs apart, and elbows turned out. Another figure 4, cattle showed stretched neck, coughing, legs apart and elbows turned out. Clear figure of a cattle showed clinical signs of contagious bovine pleuropneumonia where cattle posture changed with neck forward and woody appearance of this cow. This figure of zebu cattle with acute clinical form of contagious bovine pleuropneumonia, noticeable neck stretched, indication of respiratory distress, saliva is leading from their mouth and legs apart at the elbow region. Chronic infections with contagious bovine pleuropneumonia. Cattle showed chronic infection with contagious bovine pleuropneumonia while suffering from less obvious signs of pneumonia, coughing during exercise or long-distance walking, emaciation, take woody cow, recurrent of mild fever may be unnoticeable for owners, appearance of recovery several weeks, and at this time it will be carriers. A clear picture of emaciated diseased cow with contagious bovine pleuropneumonia in Gambia 2003. Emaciated diseased cow with chronic infection by contagious bovine pleuropneumonia where woody appearance are clear, neck stretched, and elbow parts are aparted. Chronic diseased cow showed recumbency and woody cow appearance. Congenitally infected calves with contagious bovine pleuropneumonia. These calves, while suffering from polyarthritis, may not show signs of pneumonia. Joints enlarged where organism survives and animal become a carrier one. Diseased calf with contagious bovine pleuropneumonia shows emaciation and depression. Enlarged joints with proliferation of connective tissue in a calf infected with contagious bovine pleuropneumonia. Postmortem lesions in cases of contagious bovine pleuropneumonia, it is most diagnostic. Lungs are suffering from thickening, inflammation of their tissue, extensive fibrin accumulation by means that fibrosis giving marbling appearance of the lung tissue. Acute gross lung lesions of contagious bovine pleuropneumonia in an untreated animal. Note the volume and the consolidation of the left lung. This is the left lung, this is the right one. This is a huge enlargement due to the thickening occurrence in their tissue. When we open the left side of the lung, we can show it gross lung lesions in these untreated animals. By making of cross-section, the surface of the lung exude large amount of serous fluid that accumulated here at this groove. Then pronounced intralobular thickening with marbled appearance of the lung tissue as we shown. Chronic lung lesions of contagious bovine pleuropneumonia in cross-sectioned lung of cattle showed sequestrum here in this affected lung starting to be necrotized. Chronic gross lung lesions with visible sequestrum observed. One incision of sequestrum, the necrotic content shelled out easily in heavy thickening capsuled wall as we seen. And these are the sequestra. Chronic lung lesions of contagious bovine pleuropneumonia in cattle, showing sequestrum in an affected lung with sick septa. Very clear figure of chronic lung lesions with sequestrum in an affected lung with sick septa, as we see here, giving the marbling appearance of the lung tissue. Classical prominent interlobular septa thickening, marbling appearance of lungs from cattle infected with contagious bovine pleuropneumonia. Classical prominent interlobular septa thickening, marbling appearance of lung tissues from chronically infected cattle with this disease. Chronic gross lung lesions with adherence observed in an infected cattle with contagious bovine pleuropneumonia. Very clear figure of adhesion that occur between lung tissue and thoracic wall, where we can see here the ribs and intramuscular ribs. Most pathognomonic lesions were thoracic cavity with up to 10 liters of straw-colored fluid present in the thoracic cavity. Acute gross lung lesions of contagious bovine pleuropneumonia, the thorax has been opened and an abundant quantity of clear yellow fluid, pleural liquids, is visible in the cavity. Clear lung thickening wall. Thoracic cavity of chronically diseased cattle with contagious bovine pleuropneumonia, showing here encapsulated sequestrum which become necrotized. A figure showing fibrinous mass at the lung tissue. Joints enlarged. Cattle become carrier where organisms survives, with of proliferation of connective tissue and tenosynovitis and arthritis in chronic diseased animals. This picture showing enlarged joints with proliferation of connective tissue and tenosynovitis and arthritis in chronic infected cattle with contagious bovine pleuropneumonia. Another clear figure of enlarged joints with proliferation of connective tissue and tenosynovitis and arthritis due to contagious bovine pleuropneumonia infection. Laboratory diagnosis of contagious bovine pleuropneumonia. Sampling. Because of contagious bovine pleuropneumonia is identifiable disease all over the world, so before collecting or sending any samples to any laboratory, the proper veterinary authorities should be contacted. Samples should only be sent under secure conditions to authorized laboratories to prevent the spreading of the disease. Histopathology samples are formalin-fixed lungs tissue. Mycoplasmology samples are effusion fluid taken in serum tube, lung, bronchial lymph nodes. Scheme for samples collection during contagious bovine pleuropneumonia suspicion. Suspicion animal at slaughterhouse will be made positive in PCR and isolation or negative in PCR and isolation. If it is negative, it's okay. We will not doing anything. Also, those suspicion at establishment or any area or any farm, we will make visit to this area where we will find one of three categories. Number one, dead cattle. Number 2, cattle with clinical signs. Number 3, cattle without clinical signs. In case of the cattle, we take cattle without history of any antibiotic therapy for making post-mortem examination, and then take pieces of lung of them as well as from lymph node and the pleural fluid. Send them to the lab for making PCR isolation. In case of cattle with clinical signs, we take blood samples for making latex agglutination tests and ELISA test. Those with positive latex agglutination test and those with positive ELISA test also send it to the lab for PCR and isolation. In case of cattle without any clinical signs, blood sample of them only tested by ELISA test. Those becoming positive will examined also by PCR and isolation. Only animals with PCR and isolation positive will be confirmed to be infected with contagious bovine pleuropneumonia. All animals with samples that show negative along this scheme will be not confirmed as an infected animal. Metabolic and growth inhibition tests for contagious bovine pleuropneumonia organisms. This figure shows Mycoplasma mycoides, subspecies Mycoides colonial morphology, post 3 days of incubation at heart infusion agar. A clear colony of Mycoplasma mycoides, subspecies Mycoides, a small colony. Several colonies of Mycoplasma mycoides, subspecies Mycoides, small colonies. Histopathological examination for animals suspected or be diseased with the contagious bovine pleuropneumonia. Histopathological examination in the early stages of typical lesion consists of bronchial necrosis and edema, this progressing to exudative serofibrinous bronchiolitis, then extension to the alveoli and adjacent lymphatics. This process extended to the trachobronchial lymph node and pleural lymphatics. This is a widened intralobular septa in lung tissue of diseased cattle with contagious bovine pleuropneumonia. Extensive losses of airspace of diseased lung because of necrosis and neutrophils infiltration as appear clearing here. The pulmonary lobules become consolidated with alveolar edema, fibrin and inflammatory cell. Lymphatics become thrombosed and fibrosed. The mediastinal sternal, aortic and intercostal lymph nodes are enlarged, edematous and hemorrhagic. Hyperemia of alveolar wall of capillaries, as we see here, with presence of fibrin and neutrophils infiltration. PCR positive, where all strains of Mycoplasma mycoides subspecies Mycoides has 560 base pair at the upper one and at the lower image. A table shows different strains of Mycoplasma mycoides subspecies Mycoides with their sources and their identification. Genome sequence of Mycoplasma mycoides, subspecies mycoides, small colony type strain. The genome sequencing tree of different species of Mycoplasma, Mycoplasma leishi, Mycoplasma mycoides, subspecies mycoides, Mycoplasma mycoides capri, and so on. Immunofluorescent staining for laboratory diagnosis. Immunofluorescent staining of impression smears of lungs may be more sensitive and rapid than culture, as Mycoplasma mycoides small colony antigen is present in several renal structures. Renal lesions are frequently detectable in contagious bovine pleuropneumonia in field and experimental cases. In the acute phase of the disease, multiple renal infarcts are common. In subacute and chronic cases, the infarcts progress to form large areas of fibrosis accompanied by tubular dystrophic calcification, tubular atrophy, and lymphocyte interstitial infiltrates in the kidney. Immunohistochemistry technique. Prevascular organization foci or organizing centers in the intertubular septa are considered typical of contagious bovine pleuropneumonia infection. Mycoplasma mycoides, small colony, can be demonstrated in these lobules by immunohistochemistry. Coagulation necrosis is common in these cases. Immunocytochemical tests can be used to detect the organism in tissue sections and provide valuable confirmatory diagnosis post-slaughtering. Stained antigen is visible in the smaller bronchioles and alveoli and within the intertubular septa of lung affected of any diseased animal. Serology tests for contagious bovine pleuropneumonia. Number 1, complement fixation for herd diagnosis, useful with subclinical cases. Number 2, competitive lither. Number 3, heme agglutination unused during active herd outbreaks. Number 4, fluorescent antibody technique. Number 5, agar gel immunodiffusion test. Sensitivity and specificity of different laboratory techniques on different samples material will be discussed in the following. In this table, I am clarifying the agent identification through samples material, laboratory technique, sensitivity, and specificity percents. Acute cases from cattle without antibiotic therapy. Samples materials are pleural fluid from live cattle and or carcasses. By isolation, sensitivity will be 3 positive and specificity will be 3 positive. PCR, in the sensitivity, it will be 3 positive, while specificity is more higher, 4 positive. Sequencing sensitivity is nil, while specificity is 3 positive. In case of acute and chronic cases, when we use isolation, sensitivity will be 3 positive equal to specificity. PCR will be 3 positive while specificity is 4 positive. From this table, we can identify the agent more specificity by PCR, while sensitivity of isolation and PCR are equal. This table showing the sensitivity and specificity of different laboratory techniques that used for detection and identification of antibodies in case of animals infected with contagious bovine pleuropneumonia, acute cases or recent establishment affection, Samples materials are serum, when we use latex agglutination tests or bovilat, sensitivity detect the antibodies and 8 days post clinical signs appearance and during the first 2 months, and the specificity of this latex agglutination is 2 positive. In case of ELISA detect mostly IgG post clinical signs and for more than 6 months up to a year. The specificity is 99.8% as elaborated by OIE at 2018. In case of complement fixation test that done also on the serum, OIE at 2018 said it is sensitive by 63%, while specific by 98%. Differential diagnosis between contagious bovinepleuropneumonia and different respiratory diseases affect ruminants will be the following. In presence of any infectious diseases causing respiratory manifestation, contagious bovine pleuropneumonia in endemic areas have to be differentiated from the following 12 diseases: pneumonic pasteurellosis, hemorrhagic septicemia, tuberculosis, different viral causing respiratory diseases, mycotic affection, infectious bovine rhinotracheitis, malignant catarrhal fever, cough pneumonia, cough diphtheria, enzootic pneumonia, ascariasis, and lungworm infestation. Treatment: the use of antimicrobials in affected regions is widespread because of in-poor countries, limited availability of vaccines. It is considered the only available and effective treatment and control measure in these poor countries. Treatment recommended only in endemic areas, but the use of antimicrobials is legally banned in many endemically affected countries. Elimination of the organism may be impossible by the treatment leads to carriers development. Antibiotics generally ineffective as it can result in extensive tissue damage and sequestration of the organism. Treatment successes of antimicrobial therapy to treat mycoplasma infection greatly depends on timely initiation of the treatment, but clinically affected animals in endemic area frequently are in an advanced or even chronic stage of the disease and thus are unlikely to show strong treatment response. Because of the generally poor treatment response and because these animals present a source of infection for herd mates, clinically affected animals should rather be culled than treated. In contrast, the treatment of in-contact animals appear to considerably reduce disease transmission, which resulted in a marked decrease in the disease occurrence, morbidity and mortality rates in affected herds. An increasing body of evidence suggests that use of antimicrobials primarily as a part of a disease control program should be recognized. Medicines used in treatment of contagious bovine pleuropneumonia. Number 1, tolithromycin 2.5 mg per kilogram body weight as subcutaneous injection as a single dose and may be repeated for 3 times. Fluorphenicol 20 mg per kilogram body weight intramuscular repeated 3 times. Telmecozine 10 mg per kilogram body weight subcutaneously as a single dose and may be repeated for 3 times. Gamethyromycin 6 mg per kilogram body weight subcutaneously as a single dose and can be repeated for 3 times. Danofloxacin 2.5 mg per kilogram body weight subcutaneously, repeated for 3 times. Oxytetracycline 10 mg per kilogram body weight intramuscular for at least 4 days, repeated 3 times. And tolothromycin 2 mg per kilogram subcutaneously as a single dose. Prevention and control of contagious bovine pleuropneumonia. Number 1, notification to veterinary authorities. Number 2, quarantine. Number 3, stamping out or culling to all infected and surrounding cattle. Number 4, removal of sources of infection to control or eradicate contagious bovine pleuropneumonia, enforcing suitable surveillance. Number 5, post-mortem examination to all slaughtered cases. Number 6, livestock movement control. Number 7, treatment. Quarantine and disinfection. Number 1, quarantine to all exposed animals. Number 2, disinfection of infected areas by sodium hypochlorite with 3% of sodium hypochlorite. Stabbing or culling to all infected surrounding cattle. This strategy is impractical in developing countries with a pastoral economy. This requires full cooperation of cattle owners and an adequate and timely consummation sequence. Slaughter of all sick cattle and vaccination of in-contact cattle. This strategy is used frequently and usually perpetuates the disease. In stamping out to all infected or culling off all infected and surrounding cattle, all infected and suspicious reactors and the clinical cases should be destroyed or transported under close control to abattoirs, where this cannot be done without a change of spread to animal along the route. Destruction on the farm is necessary. Animals that eventually go to the abattoirs should be kept under quarantine until slaughtering, irrespective of their status. Number 4, removal of sources of infection to control or eradicate contagious bovine pleuropneumonia, enforcing suitable surveillance strategies is imperative. Surveillance need to cover the susceptible species, cattle, and possibly buffaloes, and should compromise clinical surveillance, serological surveillance, and pathologic surveillance. Because of the limited sensitivity of the available tools, randomized surveillance is discouraged, and the interpretation of surveillance results should be interpreted on the herd level rather than an individual animal levels. Clinical surveillance aims at identifying clinical signs consistent with contagious bovine pleuropneumonia in a herd by closely examining susceptible individual animals. It requires good knowledge of the possible clinical presentation of the condition, particularly in endemic regions where affected animals may only show mild and subtle signs. It can greatly contribute to the level of confidence in the overall surveillance strategy when many animals in susceptible herd are regularly examined. Appropriate training of the personnel conducting pathologic surveillance to identify characteristic and suspicious lesion is essential. Systemic pathologic surveillance conducted on slaughterhouse materials large numbers of clinically unapparent animals is considered the most effective approach to screen for the presence of the disease within a herd and, or more important, within a region or country. Serologic surveillance. The limited sensitivity of available serologic tests serology is unsuitable as vaccinated. This practice is practically applicable in feeder cattle that will be slaughtered subsequently and when extensive outbreaks occur in closely settled areas where the chance of spread are great. Simple tests and slaughter in these latter circumstances will be too short to control the rate of spreading. In either case, the herd should not be released from quarantine until 2 tests at an interval of more than 2 months are completely negative. Vaccination against contagious bovine pleuropneumonia. Vaccination of healthy cattle with slaughter of sick cattle is an epidemic and revaccination of cattle at risk. This method depends on the ability of the authorities to detect epidemics rapidly, most effectively by abattoir surveillance, and to maintain vaccination for at least 3 years consequently. Vaccination in endemic areas must be done annually, whereas newly infected areas require repeat vaccinations aimed to eradication of the disease. Although the combination of movement control, quarantine, and culling of infected animal, when strictly enforced, can successfully eradicate contagious bovine pleuropneumonia, as is documented by numerous examples of the past centuries. This approach requires financial, number 1, and logistic effort, number 2, which beyond the means of many endemically infected African countries because of both social and civil disturbance that interfere with effective disease control. Farmers fleeing civil unrest may move their cattle to endemic areas and then return to them when the threat is over, making strict livestock movement control logistically and politically unenforceable. Unfortunately, culling of infected and in contact animals requires a system of financial reimbursement for farmers that is far beyond the financial resources of many affected African countries. In view of the epidemiological situation of this disease and the socio-economic structure of many African countries, control of the condition is largely based on vaccination in Africa, whereas treatment of affected animals, although widely practiced, is legally prohibited in many of these countries. Although there are examples of successful eradication of contagious bovine pleuropneumonia, to the content, efforts to contain the disease keep failing in many sub-Saharan countries, which lead to re-emergence of the disease in the region over the past decades and regular recurrent outbreaks in countries where the disease has previously been eradicated. Vaccination done by T1/44 strain against contagious bovine pleuropneumonia. This vaccine limits the disease spreading and may not be possible due to economic constraints. An image from Africa for vaccination against contagious bovine pleuropneumonia. To qualify as contagious bovine pleuropneumonia free country or zone, according to the rules of the OIE, so many countries must fulfill the following requirements. Qualifications as a contagious bovine pleuropneumonia free country or zone according to rules of OIE organization. Number 1. Have a record of regular and prompt animal disease reporting. Number 2. There has been no outbreaks of contagious bovine pleuropneumonia during the past 24 months. Number 3. No evidence of contagious bovine pleuropneumonia infection has been found during the past 24 months. Number 4. No vaccination has been carried during out the past 24 months, and submission of declaration to the OIE on a yearly basis stating the following. The declaration must be supported by evidence of documenting that a surveillance program is in operation and that regularly measures for the prevention and control of contagious bovine pleuropneumonia has been implemented. In case a country loses the status as contagious bovine pleuropneumonia free because of an outbreak, one of the following waiting periods appeals. Number 1, 12 months post the last case, where a stamping out policy combined with serological surveillance and strict movement control is enforced. Number 2, 12 months after slaughter of the last vaccinated animal where vaccination was used. Technical veterinary learning channel to be continued with the most perfect and the most accurate knowledge about infectious diseases of all species of animals. In Quran said, وَبَشِّرْ الصَّابِرِينَ, and give glad tidings to the patient people.